They are bright.
I know what I told you, but now I'm telling you we're facing a new strain.
What?
It spreads like the flu.
Impossible.
Fine. Go to the hospital, check it out yourself. Go without a mask, you'll see more clearly. You got 19 dead, you got hundreds more infected, and it's spreading like a brush fire. You got to isolate the sick, and I mean really isolate them, Billy. We got to get everybody else back into the houses. We got to keep them there.
We're doing that, Sam.
No, we're not doing it because I just drove through 100 people.
And they were all at Michigan, Lansing's, and various metropolitan areas around Lansing.
Yes.
Welcome back to Nothing Yet Live. I'm the Jay Tyler.
I am your Miss Partner.
And this is the COVID Corner, where we talk about all the happiness that COVID brings.
Yes, and this is an especially happy story. I don't like to be doom and gloom all the time, but I think we need to look at what's happening in Lansing, Michigan, and not assume that it can't happen here. Correct?
Yeah. Well, it's even more likely here.
Or wherever you are. It can happen wherever you are.
Well, one hospital in Lansing, Michigan, the latest COVID-19 surge is as bad as healthcare workers there have seen. Oops.
And they would be comparing it to January of 2021, which was Death March. It's pretty bad. And it may well be the leading edge of what's coming to the rest of the United States. Already 23 states have had more than 20% increase in cases in just the last 2 weeks, epidemiologist Michael Osterholm said.
You want to talk into your mic, possibly?
Oh, that might help. Normally I'm too close. I'm just a woman.
People are like, what's wrong with the sound?
Her mic's over there. Where governors are calling in the National Guard to help, and surges in the upper Midwest have been dire.
They call those like strike teams, right? Like that's what I've heard them called.
I'm not sure if that's the same as the National Guard, but
doctors. They're just like, we need doctors.
We expect to see other areas of the country also light up in the next several weeks. Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota, that's a mouthful, told CNN's Aaron Burnett.
And wait for it. Here comes the shocker of the century. Most patients by far unvaccinated. Oops.
And that's why we keep repeating this. The vast majority of Nurse Danielle Williams' COVID-19 patients are not vaccinated and had no idea they could get pummeled so hard by the virus, she told CNN.
Oops.
Before they walked in the door, they had a normal life. They were healthy people. They were out celebrating Thanksgiving, she said. And now they're here with a vaccine. Some of them are probably doing that. Teary-eyed, staring at me, asking if they're going to live or not.
I played a diarrhea joke over that. This is like the worst story. It's bad. These people are like, and then these people are gotten it like the two people they had gotten it twice.
Yeah.
And one is like, get the vaccine, and the other one's like, I'm not going to get vaccinated anyway. I should be fine.
Yeah, I've gotten it twice. I should be protected. So if you're so protected, how come you got it twice?
Fool me once. Yeah.
Michigan this week had more patients hospitalized for COVID-19 than ever, as hospitalizations jumped 88% in the past month, according to the Michigan Health and Hospital Association.
Oh, my God. So if you're not buying this vaccine shit, I don't know what to tell you.
Unvaccinated and unboosted people are dying. We're seeing more people die at a rate we've never seen before, said Jim Dover, president and CEO of Sparrow Health System. Since January, we've had about 289 deaths. 75% are unvaccinated people, he said.
Right.
Of the very few vaccinated people who died, all were more than 6 months out from the last shot of their initial COVID vaccine regimen, he said.
Okay, so, all right, go ahead. Sorry.
So we've not had a single person who has had a booster shot die from COVID.
Right. Okay.
Health experts say the best protection against COVID-19 is to get vaccinated and boosted. Only about 64.3% of eligible Americans had been fully vaccinated as of Thursday.
And that includes the booster. Fully vaccinated includes the booster, right?
I don't know.
Or is it just the initial 2 shots?
I think that
because I got to be getting close to 6 months now.
Oh, you're past it. You can get your.
I thought it was May.
It was May. So if you count 6 months from there, that brings you to
7 months.
November.
I can math. I was told there would be no math on this show.
Not on this one. He'll
What
do
are
math
these?
like
What are
crazy
these weird
off
characters?
camera.
Oh, they're numbers. And younger people are getting very sick.
Yeah. Among the new COVID-19 victims, nurse Katie Sefton has noticed a disturbing trend. We're seeing a lot of younger people, and I think that is a bit challenging, said Sefton, a 20-year-old nursing veteran. She recalled helping the family of a young adult say goodbye to their loved one.
Oh shit.
It was an awful night, she said. That was one of the worst days. I went home and just cried.
Look, nurses and doctors are fucked up enough as it is.
Yeah,
Now
they're
they've been
just
going through all
human
this shit.
beings.
Yeah.
And I don't know how many I've heard say, I did not sign up for this.
Right.
I mean,
And then they're quitting.
yeah, they did sign up for it, but they didn't think it would happen in this century. What with vaccines and all.
Well, we didn't know about it. But
Flu is making things worse.
Yep.
Influenza is much more active this year than last year, putting a strain on hospital beds, officials in Michigan told CNN. Heightened safety precautions against COVID-19 last year helped
Yeah.
stymie the spread of the flu, said Dr. Mark Rosenberg, president of the American
Yeah, because if
College
you
of
just have less
Emergency
people-
Physicians.
yeah, you just have less people commuting.
Exactly. You have less
True.
people commuting. You have people masking.
They're not gathering for a little
Right.
while. It's like,
Right.
hey, take a break from society. It was kind of nice for a minute. And then now we're coming on the back end of this thing, and it's like, it ain't over yet. And then you got overloaded hospitals, and what shouldn't be an overloaded hospital system in like Michigan.
No, it shouldn't be overloaded. It should be lots of people vaccinated, and it should be the oddballs, the breakthrough cases, and most of them should be we check them out and send them home.
Yeah, you don't have to, get the pipe shoved down your throat. Last year, people staying home, covering their faces at work, Dr. Rosenberg said. But this year, the situation could be dangerously different. COVID-19 will fucking set you up, and the flu could take you down, apparently. Apparently, that's what they're saying.
COVID-19 and the flu can attack the lungs, potentially causing pneumonia, fluid in the lungs, or respiratory failure, the U.S. Centers for Disease Control and Prevention said. Each illness can also cause sepsis, cardiac injury, and inflammation of the heart, brain, or muscle
So
tissues.
if it doesn't choke you to death, it kills you out of spite.
Well, COVID-19 pretty much kills you out of spite. It goes after
It
your kidneys.
Attacks your soft tissues.
It attacks your vascular system,
Yep.
and that affects every organ in your body.
I just don't know. Like, I like when I read this story, it was like, how does this like old lady is just like, whatever. She's like, no, I'm not going to get vaccinated. It's like, I mean, she's old. Just like she had one foot in the grave and the other on a banana peel anyway. So she was out the door. But like she's just like, I want to see my grandbabies. I don't need to get vaccinated after having it twice. At least she wasn't like, it's fake. She was just like, no, I'm not going to get vaccinated.
Did she get a really mild case both times?
Something, yeah. She was in the ward. I don't know.
Because I know a couple of people who got it, and well, I know several people who've gotten it, but this particular mother and son who got it, they said it was just like the flu. So, and they were never big on masking or anything like that. They just weren't concerned about it, and they ended up getting it, of course, and they were lucky it wasn't that bad. But that was like over a year ago.
Yeah.
This was before Delta and Omicron.
Perpetually, we have had emergency department patients in our emergency department that need to be on the floors, she said, but we're stepping on the hose we're stepping on the hose up there. There's nowhere for them to go. Okay, so across Michigan, most hospitals and health systems have gone to a code red triage, which means they're like, sorry, we're full.
They
Can you
won't
believe that?
accept transfers.
You ever imagine that? Anybody out there ever imagine like, we're full? You know, hotels
There's
are full.
no hospital that can take
Campgrounds
you.
are full. Hotels are full. Hospitals full. I've never heard of that.
You need the services that this particular facility has, but they can't take you.
Hey, once in a lifetime thing we're going through. This is fun. At least we
It's
won't have to go through
something.
it again. We won't live long enough to go through it again.
Yeah, hopefully.
21.
As we go into the holidays, if the current growth rate that we're seeing today holds, we expect to see 200 inpatient COVID patients by the end of the month on a daily basis. He said that would mean absolutely stretching us to the breaking point.
We've already discontinued inpatient elective surgery. Well, of course, yeah. No titty job for you. But it's like surgeries. I guess they just use the surgical bays for beds. If you were to be going into, say you'd be going into surgery for a boob job, you don't get that bed.
You don't get that bed, and you don't get those resources. Yeah. You don't get the.
But yeah,
the surgeons and
they're
the
stretched.
aftercare.
That's just crazy.
We've already discontinued inpatient elective surgeries in order to create electric surgeries. In order to create capacity, we took our post-anesthesia recovery unit and converted it into another critical care unit.
Tents are next. Well, that's just fucking bittersweet right there. That's some irony for you. Just get the damn vaccine. That's what I learned.
But that's what they want you to
They want you
think.
to do.
They're trying to keep you scared.
I carry my tracking device just like everybody else does.
I'm proud of mine. Yep.
Carry mine everywhere. Hey! Well, as fun as that was. No,
I'm out of
still
jokes.
Boggles the mind.
I'm out of jokes at the.
That's why we're just gonna I don't know if we might do like COVID corner once a week or something, or if something really big happens. But beating a dead horse. Talk about beating a dead horse.
At this point, it seems to me that if you haven't gotten the vaccine,
I can't believe
there's
anybody.
no convincing.
To me, it seems like I can't believe that everybody hasn't that there's all this stuff going on about it, because it seems like pretty much everybody has solidified. You know what I mean? Like people have their stance is either this or that.
Yeah,
There's
like I said, if you haven't gotten it by now,
there's not a lot
it's
of
not
people
going to
in the
happen.
middle for some reason.
They're either going to continue to think it was fake, or they're going to get it.
Anyway, even smart people are fooled by stuff.
Some of the smartest people
I've
I
known some
know
people
are
just
think that it alters your genetic code. It changes your DNA.
Maybe it does. I don't know. As long as I don't get sick, I'm cool. How's this lighting working?
It's bright.
Makeshift lighting that I put in here. We were pretty dark. We would have been. It would just been a blank screen if I had not pulled out these LED lights.
There would just be the occasional. You hear sounds and occasional lightness in the dark.
So. Oh my God. 10 days or something.
Until you.
10 days, 10 more days of shows left. No, do we even have that many days?
No. It's only after today, it's going to be 4 or 5 more days.
Ugh.
Unless we want to do a weekend show.
Say it ain't so.
It's going to go by really fast. It'll be the new year.
We just got to try some new stuff on you guys before we go. Stuff that we'll put in next year's show. Right now, it's just this. Show them your goodies. Not those.
Sorry, it's just a habit.
This segment of the show is brought to you by
San Juan Slingshots. And I got my brand new San Juan Slingshots today. And I got them the other day. And I've been playing with them. I've been shooting cat toys at windows. It's really all I can do right now. This one is bigger, but it's lighter. And it has less
kick to it.
Well, it has less tension. This one is dense, and you have to be really strong to shoot it. But I love these. These are awesome. And I'm still trying to figure out this.
As soon as she got those, the poop and turtle went to the wayside.
Yeah, I have.
I think that's.
I'm so fickle.
I bet that's stronger than you are.
Oh, I'll bet it is too. This guy knows what he's doing.
Yeah. Check him out. Davy Crockett Rowan, get your San Juan Slingshot just like she did. We'll be back in a moment to talk about the fourth segment, which is something here. Where is it? Oh, yeah. Our favorite. This is going to be a funny segment. Hopefully.
It's dark funny.
Yeah. Well, that's what we do here. Except it's hard to light. How do you lighten up a story about hospitals overflowing?
You talk about suicide.
That's right.
Plots.
That's how you do it. We'll be back in a moment with suicide plots. Not a band name. This is Nothing Got Live.